Welcome to Star Cares, a weekly program that delves into the issues that impact you and your family. This program is a public affairs feature of this radio station. Now here's your host, Michael Leach.
As women age, many health issues can be overlooked, largely because they go undiscussed. My guest today, Dr. Dana Cohen, a respected physician, author, and authority in women's health, is here to break the silence on some of the most important health challenges for women, especially over the age of 40. Let's talk about it. Dr. Cohen, thank you for joining me today and welcome to the show.
Thank you for having me.
Absolutely. What types of women's health issues often get overlooked or dismissed by their physicians?
First thing is menopausal issues. Whatever symptoms you may be having from menopause, it's a natural part of life and it doesn't have to be dealt with. You can have to talk about it because there are things that we can do to help treat that. Also, hidden viruses and cancer risks, especially women cancer risks as we get older. And I guess managing, uncomfortable conversations with our partners, especially in the bedroom, those kind of things. The biggest thing is that we need to talk about it. We need to open up these conversations with our doctors, with our friends, with our community, and get answers because there are answers out there.
Let's pause and talk about menopause first. How do you define menopause?
The definition of menopause is 1 year without a period and blood levels that are consistent with menopause. Now, that doesn't mean that you have to wait a year before you do anything about menopause. I just want to be clear because people, if you're not sleeping, you're not healthy. And often that's, one of the big things about menopause that can happen, hot flashes, all of those kind of things. That's the definition, 1 year without a period and blood levels that match.
Take a few moments and walk us through some of the symptoms that may be common and then some of the symptoms that many people may not even know about that are associated with menopause.
Yeah. So the biggest one are hot flashes, and they're uncomfortable. And I have women that sometimes say I'm getting 15 hot flashes, a day or night sweats. It can happen at night. It's uncomfortable. It's not fun. You're uncomfortable. You're sweating. You're getting beads of sweat on you. But some of the ones that we don't think about are brain fog, joint pain, dry mucous membranes all over, body changes. And then the big one I just said, sleep issues, not even necessarily from hot flashes, just not sleeping the way that you used to be sleeping.
Are there particular ages that women or age range that women might begin to experience some of these symptoms?
The typical age average is 50. That's the average age of menopause, but it can happen anywhere from, 40 to 58. It really is different for everybody. And then I've had some women, who are even a little bit younger than that. It could be normal, but you could have early menopause for other reasons. But typically 50 is the average age of most women, but it can be anything in and around those time periods.
Do all women experience symptoms of menopause?
No. The symptoms of menopause are different for everyone. I've had women who fly through it, no issues, and then I've had women who really suffer through menopause. So no, exercise and lifestyle play a role, but I've had the fittest women in my practice saying I am really suffering here. So it doesn't necessarily mean that you're unhealthy if you're having worse symptoms. We actually really don't know why some people experience worse symptoms than others.
I was going to ask you, can some of these symptoms be mitigated? Can you help yourself when you start going through these things?
So exercise and lifestyle changes do play somewhat of a role. I think on average, they do help mitigate. And so like eating cleanly, eating, real food, whole food diet, exercising, there's been some studies that do show that can help. Once again, it's not the end all be all. There are some women who still, no matter what you do, will get some symptoms.
Are there some common misconceptions that you just want to say to us? Cut it out. No, that's absolutely not true. What do you want us to know about some misconceptions?
All right, well, let's start here. There was a big New York Times article earlier this year about hormone replacement. Since the Women's Health Initiative, many gynecologists started pulling women all off their hormones, saying it's not healthy, it's not good for you. Modern medicine is amazing. There is hormones for women who are experiencing these symptoms. Talk to your doctor about it and don't think like no hormones because of maybe what was talked about in the last 10 years. So I think that's a big deal. Talking to our doctors, talking to our partners. Let's talk about cancer risks for women. I want to talk about, cervical cancer risks. That the fact that we go into menopause, we don't need pap smears anymore. We don't need to screen for cancers. That is not true. And most doctors will take this, watchful waiting approach. So if you have a positive pap smear, let's just watch and wait and see. I'm an integrative doctor, and there are absolutely things that we can do to help our immune system and boost our immune system. We need to be proactive in our healthcare. Some of the things we talked a little bit about, diet and exercise, those are, what everybody should be doing first and foremost. And I think if you want just the real simple answer for diet, eat real food, meaning get rid of ultra processed foods, just simple foods, vegetables, fish, and that kind of thing, and really minimize processed foods. That's a real simple approach. So easy to follow, and if you do that 80% of the time, you're going to be so much healthier for that. The other thing is, if you have a positive pap smear and HPV, which is the most common virus that almost everyone in this world will be exposed to in their lifetimes, we don't have to watch and wait. We can do things to boost our immune system, such as things like folic acid. There's a lot of studies that show taking folic acid can help reduce that risk of going from HPV to cervical cancer. The other thing is there's a supplement called AHCC. If you go to ahcc.net, that is an amazing mixture of medicinal mushrooms that has been shown to help clear HPV faster. So we don't have to take this watchful waiting and sit and biting our nails until the next pap smear 6 months from now. There are absolutely things that we can do that are powerful and have been shown in studies to work.
So how can women protect themselves from contracting HPV?
I don't know the actual number to that. It's extraordinarily high. It's most people. But it is extraordinarily high. So I think, the typical way that we protect from STDs is abstinence. It's condoms. It's those kind of things. The typical way that you just protect from any kind of STD is the way that you would be protected from HPV. But there's also oral forms of HPV. It's hard, I think anybody who's ever had sex is going to be a risk factor. I'm sorry to say, but the other thing is even skin-to-skin contact has been shown to transmit HPV. It's not as high as like a mucous membrane contact, but even skin-to-skin can be. And I don't want people to be so fearful of HPV because for the vast majority, if we're keeping our immune systems strong, for the vast majority, most people don't get cervical cancer or other cancers from HPV. However, those cancers, cervical cancer, anal cancer, throat cancers, those are the cancers that most of the time is caused by HPV.
And are there regular health screenings that are important for women who are past childbearing years? If we don't hear our doctors saying it, how should we be advocating for ourselves? What are some of those health screenings that are important?
Absolutely. Pap smears, mammograms. Those are the big ones. My whole big thing is just opening this conversation with your doctor. If your doctor won't talk to you and doesn't have the time to talk to you, it's time to switch doctors. I am a huge advocate for creating community in this, much like the barbershop that men have. Like, I want to create that in my office. I would love to have these Monday night barbershop meetings where we all get around and talk to each other. Women do like to talk, but they don't have anybody to talk to. They don't know who to talk to. Also, we have so much at our fingertips now on Instagram, and follow doctors who are putting out good information. There's books out there. Menopause, unfortunately, it is a big, big subject. So I think it's important to read books and arm yourself with information. This is something where I think we all need to be our own doctor and advocate in many ways, and then come armed with those questions.
Do men ever experience some of the symptoms of menopause? Because I have some people who I know, and they're like, oh, I'm going through menopause. I'm like, really? You're experiencing those symptoms? Okay. So I just had to ask it for the people in the back of the room.
I'm going to give you a great answer. It's called andropause. Men's testosterone gets lower as they get older. Yeah, men do, and also, from their partners, like there's a back and forth. We live with our partners, and, when one is suffering, let's say your partner's not sleeping, you're going to suffer. So definitely from that end, but men definitely have symptoms from lower testosterone. And there's things that can be done about that as well, whether it's natural, herbal, or medical, testosterone replacement in men, hormone replacement in women. So for sure, it's a great question.
Thank you. So how can our husbands help us to normalize conversations about women's health?
Well, let me just say, going back to the HPV thing, HPV, human papillomavirus, is a virus that all of us will be exposed to. Most of us don't have a problem with it because our immune system takes care of it. But that's not a women's issue. That's both a men and a women's issue, because men are getting cancers from HPV as women are as well, and men can carry HPV. Unfortunately, we don't have good testing for it. So opening that conversation, talking to your partners, what we're doing right now is opening that conversation is so important, and we need more of this.
And so one issue that would impact both a husband and a wife when it pertains to menopause has to do with the influence of libido in women after age 40. So that's a conversation that, a couple needs to really, really have. So do you have any tips for broaching that? That might be like a little uncomfortable for everyone.
Yeah. So while it's true, women experience it typically more often and more severe than men, this lower libido as we age. By the way, it's a very complicated thing. It's not just, I'm going to get hormones and my libido is going to come back. Often that is the answer, but it's not the only answer. So arming yourself with information, once again, reading about it. Sometimes you may want to just sort of highlight the chapter and show it to your partner and saying, let's talk about this because I don't have the libido that you have, and I want this to work. I don't want you to feel that it's you, and starting gently around that thing so that men understand, like if you show them in a book, like then they realize it's not just you and it's not them. It's not their fault. Coming from a scientific standpoint or a medical standpoint, I think is always a good idea because it just shows that it's not, I'm not interested in you anymore. It's not on me or you. It's a thing.
So what would you say to a woman whose husband is just completely uncomfortable about, having that conversation? Where else might she receive some support?
So, there's therapy. There are sex therapists, some incredible sex therapists. You could start there. They can help teach you how to speak to your husband easier. I think that's always a great place to start. Getting on message boards, talking to a group, even in that way. It doesn't have to be a group therapy in person kind of thing or a barbershop therapy like at my office. It could be just a message board about low libido in perimenopause or menopause. They exist. You could be anonymous and just reading about it. Great places to start.
So we've talked about quite a number of things in our time together. And I think it takes some processing, right? So where can we go to learn more about these health tips that you shared today?
www.drdanacohen.com, drdanacohen.com, drdanacohen.com. You can follow me on social, which is on my website. And there's a lot of information on my website too.
drdanacohen.com, drdanacohen.com. Dr. Cohen, thank you so much for joining me today and for helping us to jumpstart the conversation about women's health. Thank you.
Thank you so much.
And thank you for listening. Won't you join me again? I'm Michael Leach, and I am praying that the rest of your day is wonderful.